Hand congenital anomalies, traumas, digital replantation. The objective of this lecture is to present a overview on congenital hand anomalies, hand trauma, and digital replantation. It's important to know the embryology of the hand and the timing of this embryology, the development of the hand. The hand develops during the period between the third and to eighth week of gestation. What's the importance of this? The importance is to monitor uh, the other organs develop during this period when the baby comes with congenital hand anomalies. Of importance, these organs are the heart and the craniofacial skeletons. So when you have a child with congenital hand anomalies, you have to look for other anomalies in the heart and the craniofacial uh, skeleton. According to Swanson's classifications on congenital hand anomalies, we have six types of congenital hand anomalies: failure of formation of parts, or failure of differentiation or separation of that parts, duplication, overgrowth, undergrowth, and generalized skeletal abnormalities and syndrome. The first type is failure of formations of parts. It's either transverse arrest or longitudinal arrest. Transverse arrest does means the parts in the transverse axis of the arms have arrested to develop. Longitudinal, the arrest has appear in the longitudinal axis of the upper extremities, and these anomalies usually detected prenatally by sonar. The first failure of formation of parts, the transverse arrest, as we see in the pictures, congenital amputation. See, as if the hand is surgically amputated. And these types of transverse amputations, it's very rare, and the common levels are upper thirds of forearms, wrists, metacarpals, pharyngeal. um, Mostly will not require surgeries, but it's benefit for to have prosthesis. Of importance is the terminal digits are still present of the hand stump. Failure of formation of parts, the other types of the longitudinal arrest. If you imagine the long axis of the upper extremities is the central, so we have radial clap hand, ulnar clap hand, and central arrest on focomelia. The radial clap hands we call it pre-axial arrest. The ulnar clap hand we call it the post-axial arrest, and the central is the central arrest. In between the focomelia, intercalary arrest. اللي هو intervening segment of a limb is absent. يعني the ال hand is present and the forearm is present, and a variable distance of the forearm is absent. Okay, it's the focomelia. Intercalary arrest is the four types. The four mentioned types is called longitudinal arrest: radial clap hand preaxial, ulnar clap hand postaxial, cleft hand central arrest, or cleft hand or focomelia. Okay, radial clap hand preaxial arrest is characterized by radial deviated flexed hand with pronated and short forearms. And deficient thumb is a fixed finding in the radial clap hand. Deficient thumb or hypoplastic thumb array, and the attached carpal bones with the radial nerves and the vessels, and it is classified into grades: short radius, or hypoplastic radius, or the partial absence of the radius and replaced by fibrous tissue, or complete absence of the radius, and this is the most severe forms. The other part, ulnar clap hand, more rare than the radial clap hand. Let's call it the post-axial arrest. Ulnar clap hand, post-axial arrest. It is a very rare form of longitudinal ray deficiency, and it's characterized as we see in the pictures: bowed radius with hypoplastic or absent ulna. The third type, as we say, focomelia, intercalary arrest. This is an intervening segment of a limb is absent, and it's claimed that thalidomide, the drug thalidomide, when it's taken in the first trimesters of pregnancy, it results in vocomelias. The types is three types. Type 1, hand is directly attached to the trunk. Type 2, the proximal type, short forearm attached to the trunk. And type 3, distal, short humerus attached to the hand. Failure of formations of parts, central ray deficiency. The third part, the cleft hand. Cleft hand, there is a cleft in the central of the hand. It's characterized by deep V-shaped central defect, usually bilateral. It's associated usually with cleft feet, hypoplasia of the long ray, and associated with cleft lip, sometimes associated with cleft lip and that. The second type of congenital anomalies is due to failure of differentiation or separation of parts. Failure of separations of parts is syndactyly. Syndactyly is two digits are amalgamated or attached to each others, and syndactyly is one of the most common congenital hand malformations, and it occurs most commonly the third web, and the second occurrence is the fourth web, and lastly the second web. And the syndactyly usually it is findings associated with some syndromes like the Poland syndromes or Eppert syndromes. The types of syndactyly simply, if you have the simple syndactyly or complex syndactyly. Simple syndactyly, it's the two digits are attached through soft tissue only, while complex syndactyly is attached through there is osseous attachments or osseous fusions between the two digits. The other type, they are complete or incomplete. Complete syndactyly, the whole digits are fused or attached, while incomplete syndactyly is a variable length of the digits are attached. These some forms of syndactyly. This is as you see, it's incomplete syndactyly because the fusion is only to the half of the length of the digits to the proximal interpharyngeal joint. Here, this complete complex syndactyly, and as you see here, the complete complex syndactyly and the X-ray choose fusion, osseous fusions of the complex syndactyly. Okay. The third type of congenital malformations, the duplication of parts. The most common, the polydactyly extra digits. Most common congenital anomalies in the upper extremities. And this is different types of polydactyly. The most common is the little finger polydactyly. Okay. Overgrowth, the fourth type of congenital malformation is the overgrowth macrodactyly. As you see in the pictures, this is the macrodactyly, and macrodactyly is the primary or secondary macrodactyly. Primary, it's the primary overgrowth of the osseous parts of the digits or the soft tissue, while secondary, it is the secondary to lymphedema or hemangioma or vascular malformations. So macrodactyly is the congenital anomalies of the hand due to overgrowth. The reverse is the undergrowth or hypoplasia. Hypoplasia, the most affected part of the hand is the thumb, hypoplastic thumbs. And the type of hypoplastic thumbs, it varies from mild hypoplasia, as you see in the pictures, or moderate hypoplasia, severe hypoplasia, the very small part attached to the radial part of the hand, or a floating thumb, and aplasia, total absence of the thumb. And the last type of congenital malformation is the constriction band syndromes, quite common constricting amniotic bands or intrinsic causes. We see it very common, this congenital immediately after delivery. It's a either simple constrictions, partial or circumferential, or constriction with distal deformity, where the constriction may distal edema or distal malformation. Then we now describe the hand trauma, different types of hand trauma. Uh, the hand trauma, we have to know the different mechanisms of hand trauma and the approach to hand trauma patients. It's important to know that we have cutaneous injuries, tendon injuries, nerve injuries, and bone injuries. And finally, we will talk about amputation of parts and replantation. As you know, the hand is very vital parts for requirements for a functioning hands to have supple moving with ease, pain-free, sensate, and coordinate. About 5-10% of hospital admissions due to hand trauma great potentials for serious handicap. So it's hand injury is a very important issue. Mechanism of injury is the plant trauma, lacerations, avulsions injury, or a very common ring avulsion injury. The cutaneous injury, you have to know the anatomy of the hand and the presentation of different cutaneous injuries and brief on management. Uh, all of you know the difference between the structures of the skin, the dorsum of the hand, and the palmar surface of the hand. Cutaneous injuries are very common injuries, either open wound or closed wound. The closed wound is a contusion or hematoma. Open incised wound, lacerated wound, punctures, penetrations wound, and abrasion. Vary in depth from superficial to very deep, involving the underlying structures. These different examples of the injuries of the hand. This is an incised wound, and the pictures blue is the contusions, and the pictures lacerated or wound or abrasions. This is an example of skin lacerations, bites, contusion. The example of skin abrasion, which may be superficial or deep. This is a degloving injuries of the skin of the hand, as you see in the picture management. Uh, all of you know the difference between the structures of the skin, the dorsum of the hand, and the palmar surface of the tendon injuries. You have to be aware of the anatomy of the flexor and extensor tendon, and also the small muscle of the hands, the presentation of different types of tendon injuries, and brief on the management. Muscle of the hand, as we said, extrinsic group, extrinsic muscle, intrinsic group of muscle, either extensor and flexor tendons. This is the very simple diagram, shows the anatomy of the extensor and the flexor tendon, and the flexor, the digitorum profundus, flexor digitorum superficialis, and the relations between them, and the insertion and the extensor apparatus above. This is a degloving injuries of the skin of the hand, as you see in the picture. So here an example of extensor injuries, as you see when the extensor tendons subjects to injury, or the cut extensor injuries. The picture for a mallet finger, when they have extensor injury in the zone 1, and when the condition is neglected and be chronic, it results in botinier deformities. The botinier deformities, the hyperextension of the distal interphalangeal joint and deflection of the proximal interphalangeal joint. The tendon injuries, you have to be aware of the anatomy of the flexor and extensor tendon, and also the small muscle of the hands, the presentation of different types of tendon injuries, and brief on the management. Muscle of the hand, as we said, extrinsic group, extrinsic muscle, intrinsic group of muscle, either extensor and flexor tendons. This is the very simple diagram, shows the anatomy of the extensor and the flexor tendon, and the flexor the digitorum profundus, flexor digitorum superficialis, and the relations between them. This is the different nerve distribution, median, radial, and ulnar nerves, and the distribution of the motor and sensory supply. This is a picture for the radial nerve injury, the Saturday night palsy, inability to extend the thumb, proximal phalanges, wrist, and elbow. The hand is pronated and the thumb is adducted, total loss of extension of the fingers. Management. Muscle of the hand, as we said, extrinsic group, extrinsic muscle, intrinsic group of muscle, either extensor and flexor tendons. This is the very simple diagram, shows the anatomy of the extensor and the flexor tendon, and the flexor the digitorum profundus, flexor digitorum superficialis, and the relations between them. Left. This is a diagram for perineural neurography and group vesicular neurography. Bone injury, bone fracture management. Muscle of the hand, as we said, extrinsic tendons. This is the very simple diagram, shows the anatomy of the extensor and the flexor tendon, and the flexor the digitorum profundus, flexor digitorum superficialis, and the relations between them, and the insertion and the extensor apparatus above. Left. This is a diagram for perineural neurography. This is the different nerve distribution, media management. Muscle of the hand, as we said, extrinsic group, extrinsic muscle, intrinsic group of muscle, either extensor and flexor, and phalangeal fractures, fracture of the distal phalanx of the proximal phalanx. Here, fracture of pharyngeal fracture, fracture of the distal phalanx, as you see here, fracture of the middle phalanx. Left. This is a diagram for perineural neurography. This is the different nerve distribution, median, radial, and ulnar nerves, and the distribution of the motor and sensory supply. Management. Muscle of the hand, as we said, extrinsic group, extrinsic muscle, intrinsic group of muscle, either extensor and flexor. Here, amputation of the hand at the mid carpal level. Okay, and the replantation. In briefly, we replanted the parts by fixing the bone and reattached the repaired the tendons of the muscles, and then re and smooth the vessels, arteries, and veins. An overall success rate for replantation approach 80%. better outcome with guillotine اللي هو sharp amputation. The sharp or the sharp level of amputation, the more success. Okay. Then we now